provider's orders. I'm gonna go see John Doe today to do a wound dressing. And he is allergic to codeine. There's provider's orders that administer Trodol 30 minutes prior to every 30 minutes prior to each dressing change as needed. Removal dressing to lower extremities per protocol. Cleanse wound with the saline. Redress wound. And secure with paper tape. Perform dressing every 12 hours as needed. And apply a thin layer of triple antibiotic going into skin tear extremities. Okay. So then I'm going to walk in, knock knock. Hello, my name is Shaylee. I'm going to be your nurse today, and we're going to do a wound dressing for you. Can you verify your name? Okay, you're John Doe, and your date of birth. 10/23/62. Perfect. And do you have any allergies to codeine? Okay. And is there any latex allergies? All right. I'm going to apply some sanitizer. And then, how is your pain doing, John? No pain? How would you rate it on a scale of 1 to 10? Feeling about a 1 right now? Okay. Raise the bed up here. Perfect. So over here, and I have my trash can nearby as well. Okay. And then we're going to wash hands again and apply some gloves. All right, John, your wound is over on this side, correct? Okay, we're gonna expose this leg here. Oh crap, there's still stuff underneath here.
Oh crap. Just throw it.
So there is. Get your leg exposed here. Get your leg out.
Are you ready? Oh, go ahead and take all that off. I paused you.
You're good. We'll leave that on there.
Okay.
All right. So I have your leg exposed now. I'm going to apply this drape underneath your leg so that you have a clean working surface and don't get anything on the bed. Okay. And then we're going to remove gloves and wash our hands. So now we're going to remove your dressing from your wound here. And loosen up the edge. And here I'm examining for the color. It looks pretty normal. There's a little bit of yellow tint. No odor. Consistency is normal. And then there's a pretty normal amount on here. And then I am checking for for warmth around here, the induration, and then redness and edema and discomfort. John, is there any discomfort while I'm touching around your wound here? Nope, okay. And do that. Now I remove my gloves. And wash my hands. Alright, so now I'm going to prepare my area of, oh, I forgot to measure. So I'm going to apply gloves so that we can remeasure. Perfect. Stay away from touching it, and we'll go from the longest points on each side. And then the deepest point here, I'll leave that back. Go to the deepest point. Measure that as well. Okay, and discard. Then we would remove our gloves. And wash our hands, and then we would prep our area to apply the new dressing. So I'm going to disinfect my table here and apply a drape. And I have 2 basins. We are cleaning with the saline here. So I'm going to verify that it's still within the expiration date and it looks good here. So I'm going to clean the lip of it. We're going to swirl it around and dump a little in the trash here. And then I will put some in the first basin and the second basin. And then I'm going to put the abdominal pad. Oh, abdominal pad goes there. And then my gauze. Put them there as well. And then I will wash my hands and apply a clean set of gloves.
Tape's done.
It's done, you done? Oh, gotta get my tape out. So take 2 short pieces and 2 long pieces. And on one of the pieces here, I'm gonna put my name, the date, and the time on it. Okay. Now we will wash our hands and apply new pair of gloves here. So in our basin, we will have one gauze for cleaning and one gauze for packing. Or one basin for cleaning and one basin for packing. And then we will take our 4x4 and we will fold it up. And we are going to wipe down the center and we will throw that away. Grab a new one, wipe around the outside, throw it away. Grab a new one, wipe around this side, and throw it away. That is one technique to clean. The other one would be to grab a clean one and wipe away and throw away. Grab a new one, wipe away, throw away. New one, new one, new one, all the way down. We grab it again, new one, and going this direction, new one, this direction, new one, this direction, new one, until you get completed through cleaning the whole wound. Then we would discard that and our gloves. Oh, if there was a drain, we would, if there was a drain in the wound is going to be your cleanest place, so we are going to wipe from the wound up the drain, and if the drain was in the skin up here, the drain is going to be the cleanest place, so you'll go from the drain to the skin to clean that. And now we will go ahead and remove our gloves to apply our clean stuff. So wash our hands again. Squeeze out the excess saline. And we are going to fluff this in here and apply it to the wound, making sure to cover all of it, but staying within the wound still. Then we will grab our other, there is our other glove. Pretend this is clean. Grab our other gauze there. And then we would apply our ABD pad over top of that. Then we will go ahead and go in with our tape strips, applying to each side. We do want to keep one area, one corner open to allow in air and to allow it to drain out if there was any excess drainage. So we're going to keep this little corner open here. And then the top up here, we'll get that covered. Perfect. Alright. So then I'm going to remove my gloves, wash my hands, and apply some new gloves here. We'll get this drape from underneath you taken care of. Do like here. Throw away. And then get you all covered back up. Now we are going to assess the skin tear that is on your upper arm. So I'm going to wash my hands and get you ready for that one. For this one, we're just going to apply a little bit of ointment on your wound up here per the doctor's orders. So we're gonna review those orders again here. It says add a thin layer of triple antibiotic ointment. So I got our triple antibiotic ointment here. I'm gonna verify that it's still within the expiration date. And so we are going to grab our Q-tip. I'm gonna scrape off the bit there. And then we grab some here. With this, we apply it to the center of the wound here, rolling out with this. And we throw the Q-tip away, grabbing a new one each time. And we're spreading that ointment all around. Throw away, spreading it out until we complete the surface of the entire wound, getting around all areas. And we throw that away. And then we will remove our gloves again. Wash our hands. And then I'm going to lower the bed here. How is everything, John? Is he feeling comfortable? Okay. So it is almost dinner time, so they will come back and get you here in just a little bit for dinner. Your call light is within reach. Anything else I can get you before I head out here? No? Okay, thank you. And then I will clean up my area over here. And
Looks good, 17 minutes.